I have Medicare clients coming in and who are super duper excited because they picked a Medicare Advantage plan solely because it includes dog walking benefits. I start to get a little concerned. Sure, the MAPD extra benefits are great, but should they sway the way that you enroll? This is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it does really help the channel to grow, but also because it'll keep you up to date about the newest Medicare changes, the newest Medicare options, and ways to make more, better informed Medicare decisions. All right, here we go. So let's start off today by talking about Medicare Advantage plans and what they do and why they can offer extra things like dental or vision or hearing or dog walkers or free food or over-the-counter benefits and all the like of extra goodies that they do offer, when Medicare itself, OG Medicare, doesn't offer those things. One of the most important things to understand about Medicare is that it is a great program and that it literally provides healthcare benefits to millions and millions of Americans every year. But it doesn't cover everything, and in fact, it does have some pretty serious holes when it comes to healthcare coverage. For example, under original Medicare, that's Medicare Part A and Part B put together, for hospital coverage, there are deductibles and daily rates for stays in hospitals, but also a limit to how many days can be covered under original Medicare, which in extended stay could leave the beneficiary with some very large bills. Under the Medicare Part B portion, the portion that covers normal day-to-day healthcare, things like, doctor's visits, lab work, x-rays, physical therapy, things like that, there is co-insurance, where in general, Medicare will pay 80% of the covered Medicare costs, and the beneficiary, they're responsible for 20%. So that doesn't obviously seem too bad, but that's 20% of a limitless cost. So if there is an astronomical bill, that beneficiary is still on the hook for that 20%. So this is where Medicare Advantage and Medicare supplement plans come in to help cover those costs that are not covered by Medicare. In this case today, we're going to be talking specifically about Medicare Advantage plans, or sometimes called Medicare Part C plans, or MAPD plans, or even Medicare Health plans. And these are plans that are run by private health insurance companies, ranging from some of the largest insurance companies that are out there, many of whom you may know by name, and also sometimes run by really smaller private insurance companies that just do Medicare Advantage plans. These plans are available to Medicare beneficiaries who have both Medicare Part A and Medicare Part B that is active, and they will oftentimes provide additional coverage above and beyond what is normally covered by original Medicare. These plans can either be HMO or PPO style plans, but they are going to be structured more like traditional health plans that someone would have gotten under the age of 65 years old, maybe through their work or through an employer or through a spouse or through a union or somewhere like that. So they're going to have deductibles, they're going to have co-pays, they're going to have out-of-pocket maximum, which means that the cost for the Medicare beneficiary can be a lot more predictable and limited under these types of plans rather than just under original Medicare, where it's a 20% share of cost. Additionally, above and beyond the cost limits that the MAPD plans offer for Medicare covered services, so they do cover all the same services that original Medicare do, they also have a kind of carte blanche to offer non-Medicare covered benefits. These extra benefits are where things start to get a little murky and can get very convoluted for Medicare beneficiaries who are trying to figure out which plan fits their needs best, but also find themselves driven into these extra types of benefits. Oftentimes, the extra benefits can be things like full dental benefits, full hearing benefits, vision, transportation, and those are pretty common across the board, but there also are more additional niche benefits that some plans try to offer to gain marketing advantage over the other ones. So things like, again, dog walking or pet care, pest control, free food, over-the-counter benefits, or even the one that's very, very popular right now is to pay some or most of the cost of actually staying enrolled in the Medicare Part B. So they'll have like a Medicare Part B reimbursement. So how can they do this? Well, it kind of comes down to how these plans are compensated, because for every Medicare beneficiary who enrolls in them, they get a monthly payment from Medicare for each beneficiary that stays enrolled for each month. This money is money that Medicare had set aside initially for that beneficiary to use to pay for their healthcare under original Medicare. But for Medicare Advantage plans, the amount that they get monthly, a capitation rate, can be usually around $1,000 a month that gets paid to the insurance company for each of those members of the plan. And these plans can use that money to provide medical care and make sure that all the OG Medicare services are covered. And then anything left over, they can use to offer additional benefits like gym memberships or nursing hotlines or foot care, or things that are not normally covered by original Medicare, or, take it as profit. So as a result, this has sort of set off a Medicare Advantage extra benefit Cold War, if you will, while companies are offering more and more extra benefits to try to entice beneficiaries, sometimes at the cost of doctors' networks, at the cost of hospitals, at the cost of co-pays, because the money for one or the other all comes from the same spot. So you can't have one benefit get better without another going down. So the big question is, should these additional benefits factor into someone's decision for their Medicare plan? And for me, I would say no, and then yes. In fact, I think that whatever the extra benefits are, they should be secondary or even tertiary consideration, because the three most important parts of a Medicare health plan are the doctors the person needs and are in network, 2, the medications that a person needs that are covered on their plan's formulary, and 3, the cost fit with that person's healthcare budgets. And all three of these are equally important. There's not one that is better. But once those bases are all covered, that's when you can worry about who has the best dental, who has the best vision, who has the best hearing, who has the best dog walking, who has the best transportation, who has the best gym memberships, because those things are all well and good. But if someone can't get the care that they need, being able to buy 6 pounds of toothpaste from over-the-counter catalogs really don't help out a lot. Or even those gym memberships that you're going to enjoy having, but you're probably never going to go to. Now that's going to be it for today's Michael's Medicare. And if you have additional questions or you want to get more information about your specific situation, feel free to reach out to us at the information down below in the comments, or give us a call, or check out our other great videos on the socials, on the YouTube, on Instagram. We got great content coming out for Medicare every single week. So Michael's Medicare, I'm hoping you have a great rest of your day, and